Thank you. Good afternoon. I want to speak today specifically to two matters, that of mask and testing, because there appears to be a lot of misunderstanding as it relates to the use of mask in the general public. I have had calls from persons asking me if they should wear their mask at home, if they should sleep in their mask. I've had persons calling me to report that they saw persons in public without a mask. I've seen persons driving around in their private vehicles with a mask on. And so I want to shed some light as to the purpose of the mask and when we use the mask. The CDC recommends that people wear a cloth face mask to cover their nose and mouth in the community setting. This is to protect people around you if you are infected but do not have symptoms. A cloth face mask covering should be worn whenever people are in a community setting, especially in a situation where you may be near to people, and these settings include groceries, pharmacies. These face coverings are not a substitute for social distancing. These face coverings are especially important to wear in public in areas where there is widespread COVID illness. Wearing a cloth face mask covering, in addition to public health measures, should help to reduce the spread of COVID-19. It is still recommended that you stay at least 6 feet away from other persons, that is social distancing, and do the frequent hand cleaning and other everyday preventive actions. A cloth face covering is not intended to protect the wearer, but it may prevent the spread of virus from the wearer to others. This would be especially important if someone is infected but does not have symptoms. Cloth face coverings can be made from household items or made from common household materials at low cost. It's important to know, though, that it's not everyone who should be wearing a face mask, and I'll tell you why. Cloth face coverings should not be placed on younger children younger than 2 years of age, anyone who has trouble breathing or is unconscious or incapacitated or otherwise unable to remove the cover without assistance. This doesn't necessarily mean that you need to be in the supermarket with a 2-year-old child without a mask. It means that these persons who cannot wear a mask, they should be kept out of the general population. The surgical mask and the N95 respirators are in short supply worldwide, and these should be reserved for healthcare workers or other medical first responders. Now, as it relates to testing, in the perfect world with an unlimited resource, as it relates to testing kits, viral transport media, manpower, and laboratories, we would test the entire population, identify those with the disease, and isolate them. This is, however, not realistic or possible. The World Health Organization therefore advises that clinicians should use their judgment to determine if a patient has signs and symptoms compatible with COVID-19, and whether the patient should be tested is based on priorities. In a setting of limited resources, the guidelines for prioritization of testing are: 1, people who are at risk for developing severe disease and vulnerable population who will require hospitalization and advanced care for COVID-19. 2, healthcare workers, including emergency services and non-clinical staff, regardless of whether they are in contact with a confirmed case. And this is to protect the health workers and reduce the risk of nosocomial transmission, that is transmission within the hospital setting. 3, the first symptomatic individuals in a closed setting, example schools, long-term living facilities, prisons, and hospitals, to quickly identify outbreaks and ensure containment measures. And lastly, all individuals with symptoms related to the close setting may be considered probable cases and isolated without additional testing if testing capacity is limited. If there is no restriction to testing, then these persons, that is the contacts, should be tested. There have been a lot of questions asked about the timeliness of results, not just here, locally, but globally. And let me shed some light on that. The availability of timely and accurate results can be threatened when testing demands outstrip capacity, such as when, 1, there is a backlog of testing and it is no longer possible to turn around results within 24 to 48 hours. 2, the demand for laboratory reagents exceed the capacity for supply. 3, laboratory staff are exhausted and working hours need to be reduced. 4, the number of incoming samples exceed the capacity for safe pre-testing storage. 5, critical staff become infected or otherwise unable to perform their duties, example being quarantined. And lastly, laboratory instruments can no longer be serviced or properly maintained, especially in this era with restricted traveling. We therefore see that 1, it is not possible to test everyone, and 2, there are a number of factors that could affect the availability of results in a timely manner. What is more important in containing the disease is having measures in place to isolate known cases or quarantining suspected cases to decrease the risk of spread, while the capacity for increased testing is built up and expanded. As it relates to our federation, we have had a policy in place to test all suspected cases, be it from a history of travel or contact tracing. We had a 2-tier system in place, taking 2 samples from each patient for the PCR antigen test, which is the gold standard for testing. 1 sample was sent to CAFA, the Caribbean Public Health Agency in Trinidad, and the other done at Next Generation Lab locally. The issue with the CAFA testing is the turnaround time, as the samples have to be shipped to Trinidad and it takes a few days for us to receive the results. We considered ourselves fortunate in having a local lab with the capacity to do the COVID-19 antigen test, and we applaud Next Generation Laboratories for the significant contribution they have made thus far in this fight against the virus. Out of an abundance of caution and to ensure standardization with CAFA, 2 samples were taken and 1 sent to each lab. After several sample testings, we have a near 100% correlation with the results and have full and documented confidence in the results from our local lab. Now, CAFA, because of the large volumes of samples they have to process, have prioritized and are now only testing samples on symptomatic patients. Samples sent for asymptomatic contacts, that is persons without any symptoms, will therefore no longer be processed at CAFA. We have therefore made the decision to have our asymptomatic patient samples tested at Next Generation Laboratory and only send symptomatic patient samples to CAFA. Because of an acute shortage of viral transport media worldwide, we will also not be taking 2 samples from our patients going forward. Now, we speak about testing. What are the different types of testing? The RNA-based diagnostic test now being given looks at the presence of viral genes in a nose or throat swab, a sign of active infection. Antibody testing that you've been hearing a lot about recently can detect active infection too, but more importantly, they can tell whether a person had been infected in the past. Antibodies can appear in the blood 1 to 3 weeks after infection. The IgM antibody appears first within 3 to 5 days and indicates an acute infection, while the IgG antibody appears 3 weeks later and indicates past infection or immunity. These are the antibodies that are identified from a small blood sample obtained through a finger stick in the rapid antibody test. It's important to note that a negative test with the rapid antibody test does not rule out COVID-19 infection, particularly in those who have been in contact with the virus. The virus could be in the nostrils before one develops antibodies, which is what the antibody test is looking for. Follow-up testing with the antigen test should therefore be considered to rule out active infection in these individuals. We are now embarking on a plan for increased antibody testing with follow-up verification with the antigen tests. These tests are new, and there are a lot of manufacturers and distributors flooding the market with them. The accuracy of some of these earlier kits was brought into question as there were a lot of false positives and negatives being reported earlier. We did our due diligence and will be using 2 of these kits for rapid antibody testing and we will ensure that these results are true by backing them up with the antigen test. Now you may ask, why the rapid test? The rapid test is useful in that, one, it will help figure out who has already been sick, whether they had significant symptoms or not, and therefore who is probably immune enough to the virus to safely move around normally. It will also help our public health officials understand how much of the population has been infected by the coronavirus and if we are moving towards herd immunity. Ultimately, the antibody test will help us figure out when we can bring our country back to normal. Now, there are a number of persons, who were infected here locally with the virus, and they always ask about recovering. On average, mild illness from the onset to getting better, it takes about 2 weeks. For persons who are more seriously ill and critically ill, it takes about 3 to 6 weeks. The new coronavirus can persist in the body for at least 2 weeks after the symptoms of disease have cleared up. Thankfully, however, most of these persons during this period are not contagious. So when are you considered healthy after the coronavirus infection? In general, in order to be considered completely recovered, one of two things must be met. One, either you have 2 negative swab tests separated by at least 24 hours, or at least 72 hours have passed before, that is after respiratory symptoms and fever have resolved. However, a patient's throat swab may show low or no evidence of COVID-19 virus, although he may still be shedding the virus. Recovery clinically from COVID-19 infection does not therefore mean that one is completely virus-free. Our protocol, therefore, is one that will prevent persons who are clinically recovered from spreading the virus. And the protocol that we are using here is, 1, persons will be observed for a 14-day period after they are symptom-free, and 2, at the end of this 14-day, with 2 negative antigen tests separated by at least 24 hours apart, they will be deemed fully recovered and clear to resume normal activity. I thank you.